Athene's case is a classic example of what's wrong with the medical establishment when it comes to pain in a joint region.
At the moment I have terrible pain. If you want it on a level of 1 to 10, it's like about a 9 to 10 whenever I have to get up from a sitting position or move around in any way that involves my left hip. I went to an orthopedic surgeon and he said I have severe osteoarthritis and there's nothing to be done but to replace the hip joint totally. They said that all the cartilage between the leg joint and the hip joint was pretty much shot, and it was kind of a bone-to-bone condition. He actually did an X-ray, but he already had an MRI which I had brought him, and that was the information that he had to make his diagnosis. I live in Texas, and I came to visit my daughter in New York. When she saw how crippled I was and how much difficulty I was having in everyday life, she said, "You know, I saw some guy on a local TV show, and his name is Mitch, and he's in Farmingdale." So I came here with my husband and my daughter with her little tiny baby, and I saw Mitch, explained my situation, and he asked me about what was bothering me. I explained the diagnosis that I'd had, and I said that there was one mystery to me when I spoke to the orthopedic surgeon, and Mitch said, "What's that?" And I said, well, if he's going to replace the hip joint, what I couldn't understand was that it seemed all my pain was coming from the muscles, and I couldn't understand how replacing the hip joint would help the muscles. And Mitch said, well, what is his answer? And his answer was, there's the cosmic question. So I said to Mitch, I've come to you because I understand you're a muscle chap, and I wanted to know if there was any chance that I could do something to the muscles to help my hip and avoid surgery. He put some heat on the area in question on my hip. He pushed my hip joint and said, "Does that hurt? Does that hurt?" There was no pain. And then he pulled around some of the muscles, and that was extremely painful. He did some massage, and then he had me do 2 or 3 little stretching exercises and some exercise on the muscles. And then he said, "Okay, now get up and walk over to your husband." And I got up and walked over to my husband, and there was no pain. My husband and my daughter and I, we were almost in tears. And I said, "I just can't believe this." And Mitch said, "This is not miracles, this is just logic." To him, I guess it's just logic. To me, it was miraculous. So he did a few more exercises for the next 45 minutes. And then he wrote them down and sent me back to Texas and said, because obviously I couldn't stay here, which I was very sad. And he said, any physical therapist should be able to understand these exercises. I went 5 sessions, and they did a whole series of exercises, which may or may not have been good, I don't know, but they were excruciatingly painful. Every time I came away, I was more crippled. I phoned up Mitch and I said, "Look, if I can arrange it, my husband's already in China, I'm packing up the house in Texas. When I'm all packed up, do you think it would be possible if I arranged my trip through New York to China, that you could do anything in just a couple of weeks that I might be able to put into the schedule?" And he said, and he was wonderful, and he just said, "Oh, come on down." And I explained what I had been doing with the other physical therapists, and he said, "That's crazy, there should be no pain, you shouldn't be in any agony." And the day that I called him, I literally couldn't walk because they had done the therapy on both sides. So now my good side that I was depending on was also as crippled as my bad side, so I was kind of paralyzed for 2 days. So he said, "Don't go back to them and come back to me, and we'll see what we can do." Now he's given me a better understanding. The reason that I have bone on bone is because I'm so fat and out of condition that my muscles have shrunk, and they're shoving the bone into itself and wearing itself out. And so his theory is to strengthen the muscles, and so that they will be more flexible and the bone will push itself apart a bit and the pain will be gone. To me, the theory is wonderful because I am not I love and respect all the medical profession, but I'm not a sort of a pill taker. So surgery to me is wonderful if you've been in a car crash or something and things have come to bits and you have to sew them back together. But if we can possibly find a way to get the body to heal itself, that certainly would be preferable.
Ultimately, this is a classic case of trying to get help from the medical establishment, getting the classic diagnostic test showing something that could be found in as many people without pain as with pain, going through a process of people treating her based on that diagnosis, even though it was completely invalid, and then finally having to come to me to try to show what the true cause was, which in fact was muscular, and in fact in 95% of the cases I have treated is muscular, and provided the appropriate strength training, which resulted in a reduction in symptoms and an improvement in function. That is ultimately what people are searching for from the medical establishment. They want their symptoms resolved, they want established cause, and they want improved function. That's what we've been able to show we were able to do with Athene and with the majority, in fact 90 to 95% of the cases that I've treated.